A very important hearing in front of the Senate because these top four health officials really testifying probably for the last time before the election, and also symbolically as the US passes 200,000 deaths. Quite incredible that leading up to this election still the politicization of science continues. Witness this exchange between Dr. Rand Paul, a senator, an eye doctor, not a disease expert, and the top disease expert in the United States, Dr. Anthony Fauci, about the debunked theory of herd immunity.
Enough community immunity
Right.
that they're no longer having the pandemic because they have enough immunity in New York City to actually stop.
I challenge that, Senator. You were not listening to what the director of the CDC said, that in New York it's about 22%. If you believe 22% is herd immunity, I believe you're alone in that.
Dr. Rand Paul also saying the reason Asian countries have done so well is because they had some built-in immunity from the original SARS virus. That is not true. They are not the same, but this continues. The big concern of the American people right now is that the hints from the US president that a vaccine may be available for election day is somehow putting politics before science. And so this left his scientific advisors and experts scrambling to say, no, any vaccine timing and delivery and announcement and emergency allowance will be based on science, not fact. Here's the head of the Food and Drug Administration.
Our career scientists for any medical products, and particularly vaccines, will follow the science and data and our rigorous standards, and it won't be politics that make any part of that decision, sir.
Some good news, yes. Johnson & Johnson, the pharmaceutical giant, says they have begun stage 3 clinical trials with 60,000 people on a drug that they think could work. It's an experimental drug. If it works, is that it can be transferred below, not below sub-zero temperatures. That's great for the developing world in terms of a distribution. Also, they require one shot, not two. However, the political timing may not work out for the White House. They expect these clinical trials to end at the end of the year, not before the election. Nathan King, CGTN, at the White House.